Hi everyone, this is part 4 of our mini video series, You Asked Talk About Menopause. You can feel free to catch up on the first 3 videos. They're short videos. I just decided to break them up because menopause is just so multi-layered that I felt it would be too much to condense into one video. So in the first 3 videos, I reviewed the symptoms of menopause, bone and heart health, and sexual problems, vaginal dryness, mood swings. And if you're not yet subscribed to our channel, please hit like below on this video and subscribe as you watch this presentation. So this video, part 4 of our mini-series, will address hormonal replacement therapy or HRT, the pros, the cons, as well as alternative medicine options to manage menopause. And feel free to share this info with your friends and family who may benefit from this knowledge.
Can hormone therapy help treat menopause symptoms?
Of course, yes. HRT, hormonal replacement therapy, hormone therapy, however you want to refer to it, is effective in managing many menopausal symptoms. Now, HRT has gotten a bad rep over time. More studies are needed. I can't say that enough. But it is effective in treating hot flashes, night sweats, poor sleep, mood swings, and vaginal dryness because we're literally just replacing the estrogen that is decreased. So it's quite effective. HRT works by replacing the estrogen and progesterone in women who have stopped making these hormones during menopause. Now, HRT can improve the overall quality of life for a lot of women, as well as prevent osteoporosis, which is where we have the bone density loss and the fracture risk is reduced, which is quite impactful for women in menopause as well too. Now, HRT is available in many different forms. We have pills, patches, gels, creams, vaginal creams, suppositories, and the specific type of HRT and its dosage depends on individual needs and preferences, as well as the severity of your symptoms. And this is very important. A few months back, I got a message from someone who I think was kind of more vaguely sort of seeking for information. And the comment in the message was that I heard you don't like to prescribe HRT. I disagreed with that immediately because I prescribe it quite a fair bit time, few times for quite a fair bit of women. But it's such an individual decision because you have to consider a few things and it's not a cookie cutter situation where the same HRT will work for you the same way that it works for someone else. So I do prescribe it. I prescribe it in a consultation on an individualized basis. And it's important to understand that it can carry potential significant risks. Even though it's beneficial, it's important to have a detailed assessment and discussion about the risk versus the benefits with your healthcare professional, and especially a healthcare professional that's familiar with menopause management. The key is to determine if HRT is the right choice for you as an individual, considering your health history and your health medical history and your family history risk as well too.
Is it risky to take HRT?
This is another yes, absolutely. There are some risks. However, the risk of very serious side effects are actually quite low and depend on the type of HRT you take, how long you take it, and your own health risk. A quick recall of serious cases I've seen includes abrupt onset of severe hypertension and circulation changes, formation of blood clots, which are called DVTs if they're in the legs, and pulmonary emboli or PEs, which if the clots make it to your lungs. And I've seen these in women who were taking HRT. And the development of these complications could be directly linked to them being on HRT. Now, HRT tablets can increase the risk of blood clots, but the risk, again, still very low. HRT patches and sprays and gels have much less risk compared to the tablet form of hormonal replacement. And this is because estrogen is safer when it's absorbed into your body through your skin. So topical options while should still be taken with caution, are safer than the tablets. The stroke risk should be considered when using HRT tablets. Again, this is not as risky as with the patches and the gels and the spray options and the vaginal inserts, but there's still a slightly increased risk of stroke, especially if you're over 60 years old. And again, we'd have to consider the family history. Now, HRT can slightly increase the risk of breast cancer. It's especially important to have your breast cancer screenings done, your mammograms. Why did I find it? So is that brain fog? Anyway, it's important to have your mammograms done if you're considering or taking HRT. If you've had breast cancer, first of all, congrats on being a survivor, but you'd usually be advised not to take HRT. Right? The increased risk is low for cancer. The NHS in the UK estimates that there are around 5 extra cases of breast cancer for every 1,000 women who take HRT over a 5-year course. So the risk is there, but it's low, but still definitely be aware of the risk and whether or not you're willing to take that risk. The risk is also increased the longer you take HRT, the older you are. All right, as well too is another factor, and you would need to consider your risk carefully. Now, a lot of studies show that there's little or no risk of getting breast cancer if you haven't had breast cancer, but and you're an HRT. But if you've had breast cancer, definitely there's some risk there. More studies are needed, of course. You can reduce the risk of breast cancer by not taking HRT for longer than you need it to control your symptoms. And that's where, again, you have to check in and see how much longer do I need this? Are my symptoms better? Because staying on it indefinitely is just not an option. Abnormal uterine bleeding. It's another one I have to mention in terms of HRT and the risks. And postmenopausal spotting or bleeding are more common and needs to be evaluated if you're on HRT. The estrogen, right, that you're replacing can cause the uterine lining or trigger the uterine lining to resume growth and begin to proliferate again, which increases the risk of uterine polyps and uterine malignancy. So women who still have a uterus is who I'm talking to here with this risk. If you still have a uterus, you can receive HRT, but you should have HRT that is a combination of estrogen and progesterone just to reduce this risk of having uterine bleeding. And that's still, even though it reduces the risk, that's still something that needs to be monitored. Estrogen only HRT should only be taken if you've had a hysterectomy and you no longer have a womb, right? So yes, the risks of HRT are real. Before you start HRT, a detailed evaluation with your doctor should include a pelvic exam, pelvic ultrasound, breast exam, mammogram, pap smear. Just make sure everything's good. I also will usually order a thyroid profile if it's not up to date. Vitamin D screening because of vitamin D deficiency, which is probably coming up soon in one of these sessions. When you look up the symptoms of vitamin D deficiency, there's a huge overlap with some of these menopausal things. Liver function profile needs to be checked, especially if you're going on HRT, because estrogen can impact the liver. Anemia needs to be screened. Insomnia is a key feature of anemia. The irregular periods that you might be having, more prolonged than normal, heavier than normal. So anemia screening. B12 levels should be checked as well, especially if you have some nutritional disturbances, gut issues and so forth, or any form of bowel surgery or gastric disorders, because B12 deficiency can give you some of the nerve changes that might happen as well too. And they should be checked before starting HRT. And this is key, right? So one example, one of the more random menopausal symptoms, for example, is frozen shoulder or shoulder pain, which, again, not wanting to talk about myself too much, is another feature that I get. And it's important to ensure that, hey, is it menopause? Or do I need to check my B12 because I'm vegetarian and I don't get enough B12 supplements and I'm getting a nerve pain instead? So again, there are a few layers to this cake. So definitely screening as we try to tease out what's going on is important as well too.
How long would I need to stay on HRT?
There's no fixed time to be on HRT, right? You can take it for a few years, especially during the worst of your symptoms, or potentially for longer if you're still benefiting from being on them with no side effects or risks that you should be concerned about. The decision to stop HRT depends on individual factors, such as your age, your symptoms, and other risk factors. For example, if I'm on HRT, but my GP, my medical doctor, is starting me on blood pressure meds, and my blood pressure is not being controlled, or my cholesterol is not being controlled, then those are risk factors that might now change based compared to when I first started taking HRT. So factors to consider when you decide on how long to take HRT include the severity of your symptoms. So if your symptoms are severe, you may need to take the HRT for a longer period to manage them effectively, right? Age and menopause status. So if you have premature menopause or early menopause, which I already said was earlier than age 40, you may be advised to take HRT for a longer window of time, preferably until you reach the average age of menopause around age 50, 51. Risk factors to consider when deciding how long you should take HRT are your overall health, any risk factors you may develop, family history, family members with breast cancer, a significant amount of heart disease in the family, and so forth should be considered. If you're experiencing significant benefits from HRT, such as relief from hot flashes and improved mood, you can monitor the need to continue your symptoms over time. Now, the decision to start HRT and the duration of HRT therapy, again, extremely personalized decision that should be discussed with your doctor. Plan to consistently review or check in, as I said, with how you feel on your HRT treatment, and make sure to have at least an annual assessment to just revisit how you're doing and to make any necessary adjustments to your dose or to the type of HRT that you require.
There are many herbal remedies online that claim to improve menopause. What should I be taking?
So I'm sure you are well aware that several herbal remedies and supplements are often used for menopause. Forgive me, I may not, it's impossible for me to address every single one, and I may miss one or two off the list, just like I probably did when I was listing out the symptoms in video one. It's just so much, right? So, but I will touch on some of the more common herbs. And fortunately, a lot of herbal supplements for menopause are sold or packaged as blends, right? So menopausal blends, you may get a multivitamin that targets menopause. So that takes away from you having to go seeking each one of these individual ingredients out. So you can look for them in a blend of things, as well as consider the fact that with most supplements, and I say this again also with PCOS, a lot of brands are not necessarily vetted or put through a lot of drug trials. So sometimes you have to do your own research when you're looking at supplements. Look for brands that are actually certified in some way, read reviews, and just understand that there is some murkiness in the world of supplements out there, which is why I think it's important to at least know the ingredients that should make sense for you, right? So the list is long. But also, if you follow us on social media, you will see that we often spotlight herbal remedies for hormonal conditions, PMS, PCOS, menopause. So just follow us on any of our social media platforms, and there's a constant stream of information in our posts as well, too. So herbal remedies and supplements that are commonly used for menopause. Black cohosh is one of the key ones I would mention with regards to hot flashes and night sweats. And again, you can get this usually formulated within a menopausal blend. Red clover is an oldie but a goodie. And our grandmothers would use this, and their moms would use this. And the red clover could be found in a tea form as well, too. Locally here, they use hibiscus tea. In the Caribbean, we would also be able to use sorrel. Now, this is not red clover, but there are variations and substitutes as well that could be used. But red clover itself, especially if it's contained in a supplement, has qualities that may mimic estrogen and potentially ease symptoms without needing to be on estrogen, right? St. John's wort wart. I'm not ever sure how to pronounce that, but it does help with the mood swings and depression. And this works for men and women as well too, in terms of a mood stabilizer. Evening primrose oil, which is usually sold actually as a capsule and not an oil. These have been fairly decently studied compared to a lot of other herbs where menopause is concerned, and has been proven to help with hot flashes and also breast pain, which is on the list of 34 symptoms of menopause. Breast pain is on that list. And if you suffer with painful inflamed breast soreness, electric kind of zipping pain that happens in the breast, evening primrose oil helps with that, and it helps with the hot flashes. Personal story here, I tried evening primrose oil for night sweats. Did not do much. I actually gave my bottle away because I did not see much of a difference. Usually when you're trying these, though, you should be consistent. You should take it the way that the manufacturer advises, which I probably didn't do, because I found it was also requiring a few times, the dosages were 3 times a day, so I fell back on that. But even when I took it consistently, I did not see a great improvement in night sweats. But for a lot of women, the daytime hot flashes, the evening primrose oil tends to knock those out nicely. Ginseng is another one that I would have bought at one point. That's supposed to help with fatigue, stress, and moods. I will say, if your life is stressful, your job is stressful, your sleep habits are poor, your nutrition is poor, ginseng does not stand a chance in fixing all of that for you, right? I'm a huge fan of flax seeds. Flaxseed comes in many different versions. You can get it powdered, you can bake with it. I use it as a supplement for eggs, sometimes in baking. You can use the flax seeds in smoothies. But the flaxseed and flaxseed oil, of course, can help with the night sweats. And that's where I landed in terms of getting more relief than with the evening primrose, which works much better for daytime flashes, hot flashes. Soy is another one that's thought to have what we call isoflavones, which is what is the ingredient in the red clover that I mentioned. So soy also has those, and those tend to mimic estrogen and help with symptoms. Now, soy also has gotten, I think, a bit of a bad rep also for, caution and side effects and so forth. But soy has been used for a long time to reduce hot flashes and night sweats. But just take caution, because for some people, when they have a lot of soy intake, and whether it's soy milk or soy-based products, it can paradoxically trigger breast symptoms. So just be mindful of that. Rounding up the list here, there's valerian root, which helps with sleeps and anxiety. That's an old one. Maca root can help with fatigue, stress, and libido. There's that testosterone in there. So I have a lot of stories, but a couple years ago, I did have a woman come into the office who was receiving testosterone injections from a medical doctor, not a gynecologist, because her husband complained about her libido being low. And of course, she had a full face of adult acne. She was losing hair. She had chin hair. She had hair on her chest. Her moods were no better. Her libido was no better. So just be mindful that there is a role for testosterone supplementation. But I did not feel that the doctor who was giving her those injections understood what was being done, and it was very, very harmful to her. Fortunately, once she stopped taking the injections, I actually directed her more towards doing ashwagandha, maca root, trying those things where libido was concerned. And then also, specifically with her, there was a huge amount of relationship discord. So before we blame low testosterone and menopause and libido, we definitely need to take stock of these things as well too. Rounding up the list of supplements, chamomile, which chamomile or chamomile, tomato, I don't say tomato, but chamomile, which is usually in a tea form, helps with sleep and anxiety. And this is a big one for PMS and PMDD. Remember, I said estrogen is low at that time as well too. So ditch the caffeine and maybe do like a chamomile tea or a ginger tea or something of that nature to help with sleep and anxiety. Magnesium is something I'm a big fan of. Magnesium glycinate, magnesium threonate, vitamin K2. These can help with reducing muscle cramps, generalized body fatigue, and a lot of other symptoms. Improved sleep, more restful sleep, and moods, balanced moods as well too. Calcium is so critical for bone health during menopause. That's all I got. Take your calcium. And calcium should always come with vitamin D, vitamin D3, which is a huge, huge, huge impact on bone health, but not just bone health, fatigue and anxiety and depression as well too. Important things to consider with treatment of menopausal symptoms is that you should acknowledge and reduce or stop toxic habits such as frequent or excessive alcohol, tobacco smoking, and any use of any illicit substances that can alter your moods and cause physical symptoms, right? Toxic habits also include poor or inadequate nutrition, inactivity, inadequate hydration, poor sleep habits, which can all amplify symptoms of menopause. So life could be better if we cut some of these things out and improve some of these things. Managing a healthy lifestyle, regular exercise, a balanced diet, and stress management can also help manage menopausal symptoms. Have a discussion with your doctor before starting a new supplement regimen, just to ensure it's safe and appropriate for you, your individual needs. Some herbs and supplements can interact with medications, right? So just keep that in mind. That's important too if, let's say, you're being prescribed something or you're going for some other form of surgery or surgical procedure. It's always important to disclose which herbs and supplements you might be on. Also, remember that just as menopause can be a very individualized experience, the effectiveness of herbal remedies and supplements can vary from person to person, right? And while herbal remedies and supplements may offer some relief, they are not a substitute for HRT or hormone replacement therapy, especially if symptoms persist or worsen. All right. Okay. So we made it through all 4 parts of this month's installment of You Ask Doc About. Menopause remains a mystery in so many ways. More research is desperately needed. But luckily, I saved you that exhausting trip down the internet rabbit hole. This series highlighted the key things that women entering menopause need to better understand about what they might be experiencing. As always, I thank you for your time and attention. Feel free to leave any questions or compliments in the comments. Like this video and subscribe to our YouTube channel. You can also book an online consultation with me for a one-on-one discussion of your specific concerns. Bookings for online consults can be made easily via our website. You'll see all the details below, but visit us at azaleahealtht.com. Thank you. And next month, you can look forward to You Ask Doc About inflammation. Big topic, but I'm going to dice it up nice and concise for you. We're going to talk about inflammatory disorders, whether we're talking about autoimmune disorders. We're going to touch on lupus, celiac disease, inflammatory bowel disease, a lot. What am I missing? Arthritis, just chronic illness due to inflammation. And on that list also, I'll probably be try to include endometriosis, but I did a full breakdown of endometriosis in our video last month. So if you subscribe to our channel, you can sort of click around and see that there's a lot of information in store for you. Thank you and stay blessed.